Did you know the idea that people with autism don't like affection is actually a myth? Did you know autism doesn't just affect children? Children with autism grow up to be adults with autism, but compared to children, we know relatively little about the numbers of adults and their needs in adulthood. Did you know boys are 4 times more likely to develop autism than girls? Estimates vary between 4 to 1 and 15 to 1. Did you know 40% of all children with autism have to wait more than 3 years for a clear diagnosis from their doctor? Did you know people with autism often want to make friends, but due to their disability, find it very difficult?
He's weird. Yeah, totally. Let's go.
Did you know less than 15% of adults with autism are in full-time paid employment, even though they may have the adequate cognitive and communicative ability to perform functional and meaningful tasks and jobs? The buzz about autism is everywhere these days. The current numbers released by the CDC are increasing at alarming rates. It is more common than diabetes, cancer, or Down syndrome. With numbers this high, it is apparent that autism touches everyone in some way. Based on statistics from the U.S. Department of Education and other government agencies, autism is growing at a startling rate of 10 to 17% per year. At this rate, the Autism Society estimates that the prevalence of autism could reach 4 million Americans in the next decade. Autism knows no racial, ethnic, or social boundaries, family income levels, lifestyle choices, or educational levels, and can affect any family and any child. Some families experience autism firsthand. Others experience it secondhand, such as within their communities or social circles. After we examine all of the impacts of ASD, including social, economical, and educational, it is obvious that we are all affected directly or indirectly by this disorder. Although there are similarities in people with ASD, the spectrum is diverse. The individuals are so unique, no two are exactly alike. So what exactly is autism? We are going to take a look at this question, but go further and consider the lives of those affected by autism, learn about the diversity existing within the diagnosis, and explore the different phases of autism.
Autism steals. Autism leaves an empty shell. Autism is no hope, no future. These aren't facts, these are myths. I'm an autistic person, and the national conversation about autism is happening without us. This has to change.
Autism is an integral part of who I am and how I see the world. I've embraced it, and it has made me stronger. I am a mom, a wife, a writer, social worker, and activist.
People need to treat me with respect because I have autism, but I am still a person first.
My brain may look a little different, but that makes me good at a lot of things. I'm a musician, mathematician, and scholar. With support, I can do anything anybody else can do, even if it isn't in the same way.
Our futures have not been stolen. Our lives are not tragedies.
You must hear our voices.
Leave the old stereotypes behind.
Autism is a general term used to describe a constellation of complex developmental disorders known as autism spectrum disorders. Some people also refer to this as the autism spectrum. Persistent deficits in social communication and social interaction across contexts, not accounted for by general developmental delays.
Oh, nerds! I want nerds! Look at those pink, crunchy nerds.
engagement in repetitive or stereotypic movements, phrases, or movements of objects. And these symptoms together limit and impair everyday functioning. The symptoms must be present in early childhood, but may not become fully manifest until social demands exceed limited capabilities. Several diagnostic instruments are available. 2 are commonly used in autism research: the Autism Diagnostic Interview Revised, which is a semi-structured parent interview, and the Autism Diagnostics Observation Schedule, uses observation and interaction with the child. The Childhood Autism Rating Scale is used widely in clinical environments to assess severity of autism based on observation of the children.
What umbrella term is autism under? It's under pervasive developmental disorders. This video was produced when the DSM-IV was published. So now under the DSM-IV, there is no umbrella term of pervasive developmental disorders. It's just all called autism. The 3 main diagnostic criteria of ASD are impairments in communication, social interactions, and stereotypical movements and or phrases. And that would be it. Great, good job. Hope you got those right.
As we mentioned before, autism is a spectrum, and where an individual is on the spectrum is based on the individual's skill set. There are those who have little vocal communication, and those whose verbal ability and vocabulary are probably more extensive than most. But both of these individuals fall within the autism spectrum. Asperger syndrome is often referred to as high-functioning autism, but has its own set of diagnostic criteria that differs from autism just a bit. Although it has been removed from the most recent version of the DSM, we will still discuss it as there are many people currently diagnosed with Asperger's, and those who work with individuals on the autism spectrum will still encounter individuals with this diagnosis. It, too, is characterized by the impairment in social interaction and restrictive, repetitive, and stereotype patterns of behavior, interests, and activities. Although much of the criteria is the same, the disorder might manifest itself quite differently in an individual with Asperger's. With Asperger syndrome, the individual may engage in social interactions, but these social interactions may be characterized as odd or lacking in social etiquette, such as talking to someone in close proximity, talking about something off topic, or walking away from a person mid-conversation. Restricted and repetitive patterns of behavior, interests, or activities for an individual with Asperger syndrome may include an unusual fascination or perseveration with specific objects or activities, such as a person reading about, talking about, and collecting trains. Children with Asperger syndrome are often referred to as little professors, as they have a unique ability to retain factual information about an area of interest, such as everything you wanted to know about vacuums, including all the vacuums manufacturers, or all about the hybridization process of orchids. The disturbance causes clinically significant impairments in social, occupational, or other important areas of functioning. But the criteria also goes on to include that there is no clinically significant general delay in language, which differs from the autism diagnosis. For example, a child with Asperger syndrome may have developed words by the age of 2 and communicative phrases by age 3. Asperger syndrome criteria suggests that there is no clinically significant delay in cognitive development or in the development of age-appropriate self-help skills, adaptive behavior, and curiosity about the environment in childhood. These children with Asperger syndrome often excel in academics. Some can have higher than average IQs or the ability to read at a very young age. Although they may have high academic intelligence, they may seem to lack street smarts. Some have difficulty understanding figurative language and can be very literal. They may not understand humor, idioms, sarcasm, and teasing. Some children with Asperger syndrome may require special education services because of their social and behavioral difficulties, although many attend regular education classes. Adolescents with Asperger syndrome may exhibit ongoing difficulty with self-help skills, organization, and difficulty with social and romantic relationships. Despite high cognitive ability, most young adults with Asperger's continue to live at home, although some do marry and work independently. The differences that adolescents with Asperger syndrome experience can be traumatic. Depression is often the result of chronic frustration from repeated failure to engage others socially, and mood disorders such as anxiety requiring treatment may develop.
In what ways does the Asperger syndrome diagnosis differ from autism diagnosis? So in Asperger's, generally there's no delay in language, there's no significant delay in cognition. Typically there's age-appropriate self-help skills and curiosity. So I'm going to say all of the above. Perfect.
A child psychologist from Johns Hopkins University in Baltimore named Dr. Leo Kanner first identified the characteristics of autism in 1943. In the 1943 paper, Kanner called attention to what appeared to him as a lack of warmth among the fathers and mothers of autistic children. In his 1949 paper, Kanner suggested autism may be related to a genuine lack of maternal warmth. In a 1960 interview, Kanner sadly and bluntly described parents of autistic children as just happening to defrost enough to produce a child. The label refrigerator mother was based on these statements. As a result, mothers of some children on the autism spectrum suffered from blame, guilt, and self-doubt from the 1950s throughout the 1970s. During this time, the prevailing medical belief that autism resulted from inadequate parenting was assumed to be correct. At the same time that Kanner was studying the characteristics of autism at Johns Hopkins, Dr. Hans Asperger was studying children in Vienna, Austria, with similar characteristics. He noted that they did not have severe language delays, as Kanner was reporting. Respectfully, Asperger syndrome was coined after the Austrian doctor. In 1965, a psychologist named Bernard Rimland, also a parent of a child with autism, wrote an article in the journal called Infantile Autism, the Syndrome and Its Implications for a Neural Theory of Behavior. In this publication, he suggested that autism was a biological disorder. This was a paramount moment in the history of autism. Rimland went on to found the Autism Society of America in 1965. He also launched the Autism Research Institute in San Diego in 1967 in order to create a worldwide research center. Up until 1975, before the Individuals with Disabilities Education Act, IDEA, children with disabilities were not given an opportunity to attend public school. Children were often homebound, and parents had to pay for any private education out of pocket. In 1975, this federal legislation called IDEA was passed, mandating free and appropriate education for all children with disabilities in their public schools. This was the beginning of special education. In 1980, autism was officially added to the Diagnostic and Statistical Manual of Mental Disorders, or DSM. Beginning in the 1980s, treatments using applied behavior analysis came into the picture. Research conducted by Dr. Ivar Lovaas and colleagues at UCLA began to gain some publicity. In the late 1980s, interest peaked after the Oscar-winning film Rain Man was released. It provided an account of a man with savant-like characteristics and gave the public a heartwarming story of autism. For the first time, millions of people were introduced to autism through this movie starring Dustin Hoffman and Tom Cruise. The prevalence of autism has continued to increase beginning in the 1990s until today.
Who wrote a publication suggesting that autism was a biological disorder and founded the Autism Society of America and the Autism Research Institute? Bernard Rimland. Oops, wrong. What was so important about federal legislation, IDEA? It made it public knowledge that autism is not caused by mothers, but that it is a biological disorder. It required parents to provide education to children with autism at home with school supervision. It mandated free and appropriate education for all children with disabilities in their public schools. That's the one. Perfect. This was the beginning of special education.
There is no known single cause for autism. Researchers are investigating a number of theories, including the link between heredity, genetics, and medical problems. In many families, there appears to be a pattern of autism or related disabilities, further supporting a genetic basis to the disorder. Some research may indicate that other factors besides the genetic components are contributing to the rise and increasing occurrences of ASD, such as environmental toxins, which are more prevalent in our environment nowadays than in the past. Discussions surrounding causes of autism can be a heated debate. Some groups are adamant that vaccines contribute to the rising rates of autism. Others believe it may be linked to diet and inability to metabolize certain substances. Even after all of the research, the cause of autism is still a mystery.
True or false? It has been confirmed that the continued rise in autism is caused by the environmental stimuli such as toxins, immunizations, and diet. False. The jury is still out.
What does autism look like? Well, for each individual, it looks very different. But there are some common characteristics that you may see when you encounter individuals on the spectrum. They may have some splinter skills of abilities, such as poor gross motor or fine motor skills and the ability to read at a very young age, referred to as hyperlexia. Some may be oversensitive or undersensitive to pain. A child may get hit on the head really hard and then get up and act like nothing happened.
Ow.
Some are known to repeat words or phrases rather than engaging in typical language or conversation when spoken to. This is known as echolalia. Persons with ASD may have excessive or frequent tantrums. Some individuals with ASD may rewind movies or script lines or imitate actions from movies excessively in the place of conversation. This is sometimes called movie talk or scripting. Many exhibit poor eye contact, lack of responding when their name is called, or poor joint attention or social referencing. Others may not like being in large or noisy crowds, or have abnormal fears. For example, a child may be terrified of an escalator and scream and cry if encouraged to use one. Many have difficulty with carrying on conversations with others. Some may be overly sensitive to noises, tags in clothing, coarse clothing, lights, or smells. Others frequently use peripheral vision to watch movements of items, for example, rolling a car along a countertop at eye level or spinning wheels. They may exhibit highly self-restricted diets. Many of them are picky eaters and have a very limited repertoire of food they will eat. Lack of imaginative play, functional play with toys, or lack of ability to imitate others is also common. an unvarying pattern of daily activities or schedules. For example, an insistence on an unchanging weekly menu, route to school, or extensive bedtime ritual can be challenging for caregivers to accommodate. Self-injury or aggressive behaviors are also common. These include movements that injure others, or when the individual self-injures, such as eye poking, skin picking, hand biting, and head banging. A 2007 study reported that self-injury affected about 30% of children with ASD at some point in their lives. Research now suggests that some signs can be detected by the age of 12 months. Early signs may include no big smiles or other warm, joyful expressions by 6 months or thereafter. No back and forth sharing of sounds, smiles, or other facial expressions by 9 months or thereafter. No babbling by 12 months. No words by 16 months. No two-word meaningful phrases without imitating or repeating by 24 months. Any loss of speech or babbling or social skills at any age.
Hi, Kainoa! Hi, Kainoa! Hi, Kainoa!
Repetitive movements with objects.
True or false? Early signs can be detected at 12 months. True. The following are early signs of autism. No smiles, crawling, or eye contact before 6 months. No back and forth smiles by 6 months. No babbling by 12 months. And no words by 16 months. I think that's the best choice. Perfect. Good job.
Autism does not just affect the individuals with the diagnosis. It has a profound impact on their families as well. Families usually are not prepared for the diagnosis of autism. It changes the direction of a family's life in ways that they could never imagine. Some common challenges for families include strain on the marriage.
So it also put a big stress on our marriage because it's not a normal state of living to live in a prison.
Taking care of and balancing attention with siblings of the individual with autism. The effects of having a sibling with autism can be very stressful for families for a number of reasons. The child with autism may be aggressive towards the siblings.
Yesterday he had me in tears. He pushed the baby down the stairs twice because now the aggression is kind of going outwards.
Or it could just be having to develop a relationship with a sibling where the siblings do not have anything in common or can't communicate with each other as typical siblings do. Many will need support in learning how to interact with their autistic brother or sister.
I first teach them how to jump on the bed. Not on the bed. Jumping on the top of the couch, grab walk. I teach them to do many things, like go on a swing, how to go on a swing.
Some families hesitate to take part in leisure activities such as the beach and community outings like the grocery store due to the embarrassing behaviors that have become part of daily life.
And Randy's like, oh, go do something, go out to a movie or something, and I always wait till they go to bed because I don't want to it's no fun to go see a movie when I'm sitting there going, I wonder if Levi's okay. Oh yeah. I wonder if he's banging his head. But we don't go anywhere together because we're afraid to leave him with anybody. Because it's pretty extreme behaviors for a babysitter. Even family.
Families also have many new responsibilities and appointments they have to juggle. Parents may get overwhelmed with all the new information they have to learn and choices they have to make. Some people refer to autism as a puzzle, and for families, it is like putting the many pieces of the puzzle of autism together. And sometimes the pieces do not fit together so easily. Being sensitive to all of these issues when working with a family is important. Oftentimes we, as professionals, forget that after we work with the individual, we hand them back over to their parents and return to our daily lives. The parents continue to care for the individual 24 hours a day, 7 days a week. These individuals will only be temporarily part of our lives. For families who have individuals with autism, the person is a part of their life forever. These families love and care for their family member with autism, but the weight of the responsibility and challenges is often overwhelming for some.
When Kubik got diagnosed, he was pretty much a nightmare. He didn't sleep at night, he did not eat, he did not talk. I couldn't handle him. I didn't know what to do. I thought I was a bad mother.
If you have not found out already, the love a family has for their children overcomes many of the challenges they face, and many families do find hope and acceptance in the differences, and many learn to embrace them.
That's my Jamie. That's my Jamie. He's mine. He's my baby. The bad days get really bad sometimes, but most of the time the good outweighs the bad, because he's a cute little dude, and we love him. I wouldn't trade him for any other kid in the world, even with everything. He's my buddy. So I don't want people to go to you. Happy birthday to you. Happy birthday, dear Noah. Happy birthday to you.
All of the following are common experiences for a child with autism except marital strain, taking care of and balancing attention with siblings, sacrifice of leisure time and activities, the lack of love they feel for their child with autism. Probably that one. Yes, that's the one.
There are many different treatments available for autism, some with very unfounded and unproven claims, others with much evidence to support their effectiveness. There are biomedical treatments, behavioral or educational treatments, psychiatric medications, and other therapies. Biomedical interventions are often adopted by parents. Some interventions include the gluten and casein-free diet, dietary supplements, chelation therapy, and hyperbaric oxygen therapy. Behavioral and educational interventions include speech therapy, structured teaching, applied behavior analysis, and occupational therapy. Psychiatric medications are often prescribed by psychiatrists to treat symptoms of autism, such as aggression, anxiety, and obsessive-compulsive behaviors, and some common drugs prescribed are Prozac, Zoloft, and Risperidol. Other therapies that are out there are sensory integration, music therapy, neurofeedback, and animal-assisted therapy.
True or false, there are only a few treatments available for people with autism. False. The consumers should do their research to see which ones are evidence-based before they choose.
How does one navigate through all the available treatments to decide which therapy will be most effective? If you type in autism to search the internet, a gazillion links will pop up for you to scroll through. What should parents do? There are so many choices to make. Consumers of autism treatment have a plethora of options facing them. This is a challenging endeavor, needless to say. We suggest making treatment decisions based on the research published in peer-reviewed journals. This means treatment protocols that have research with evidence to support their effectiveness and have been reviewed by other researchers to ensure that the study has been conducted well. The National Standards Project is the most systematic review of autism treatment literature ever completed. The National Standards Project's objective was to provide straightforward information to parents, educators, and service providers that can help them make informed treatment decisions, to create an evidence-based set of practice guidelines for ASD that address some of the limitations of previous guidelines, to identify critical areas in which additional research should be conducted, and promote evidence-based practice in the treatment of ASD.
Read. Go.
What's that?
Banana.
What goes with socks? Shoes.
Shoes.
What goes with shoes? Good. Clap. Do this. Nice. What is it?
Nose.
Do this. What's this part of the banana?
This project identified established treatments. These treatments of autism have repeated demonstrations of positive outcomes in scientific research. These treatments all fall under the umbrella of applied behavior analysis. People with autism spectrum disorders deserve the right to effective treatment. Let's seek to encourage the use of these approaches which have data to support them. Increased language, better social skills, improved behavior, and adaptive skills are all results of effective teaching. Effective teaching comes from the use of evidence-based procedures for teaching learners with autism.